PPE stands for Personalized Protective Equipment. As defined by OSHA, Occupational Safety and Administration, this is specialized clothing or equipment worn by an employee for protection against infectious materials. This gear is protective. If it is not used properly, it provides no protection against hazardous substances. These hazardous materials can be chemical, radiological, physical, or many other things. It's always important to know what risks of exactly what you are trying to protect yourself from, what kind of substance it is, and what exactly it can do. So, what exactly does PPE entail? The protective gear includes gloves, gowns, or aprons, facial protection, and respiratory protection. Put this equipment on before you enter the room where the patient is present. Firstly, start with a gown. Note, if you have long hair, it is advisable to tie it up before anything else. Select a size that fully covers you, your arms, your torso, your knees, your wrists. It should be positioned in a way where the ties are at your back. Before you start tying anything, overlap the back so that it covers as much as it possibly can. When this is complete, begin tying the upper portion. This may be somewhat difficult at first since you cannot see the ties. This is also where tying your hair up comes in handy. When this is complete, begin tying the ones at your waist. Next is a safety mask. This will prevent the infectious material from entering through your respiratory system. This should be fairly simple. Simply put the mask over your mouth and wired side up. Put the loops over your ears. After this is done, pinch the wired side by your nose that is firm on your nose. This prevents any infectious material from getting in through there. The breathing may be difficult to get used to and requires a certain amount of practice. If you feel lightheaded, take the mask off and breathe for a bit. Lastly, put on your gloves. Make sure they are the proper size for you. If they are too small, they'll tear. If they're too big, they'll fall off or have loose ends where infectious material can get in. Ensure the gloves go up to the point where they cover the cuff of the gown. Now to take it off. Remember, the surface of all of your equipment is now contaminated, with the exception of the back of your gown, and you must avoid touching it. Start with your gloves. With your first removal, pinch the palm over the glove and slide it off your hand. Keep the removed glove in your still gloved hand. The other one is a bit more complicated, as you now have a bare hand which can become contaminated. Since you cannot touch the surface of the other glove, slide your fingers underneath the glove at the wrist area. Not at the bottom, but underneath the glove. Slide it up and the glove will be safely inside out. You can get the other glove that you're holding inside of it. Dispose of the gloves safely. Now remove the gown. Start with untying the tie at your waist. When it is untied, let the strings fall down. Now begin to untie the tie at your neck. When it is untied, gently push the gown away from your neck and shoulder while avoiding touching the surface of the gown. Make sure you are only touching the inside of the gown. The gown should be turned inside out now, and now roll it up, away from your body. Now dispose of it. Finally, remove the face mask. Again, the front of this mask is contaminated, so to remove it, simply unhook the loops at the ear and then dispose of it.